Since the beginning of the day, we finally have been insisting concerning different passionate presentations, how we can improve healthcare for patients, and it's extraordinary, this presentation. Now we're going to be talking about a painful subject, because it's not to improve the patient, however, it is really to have them taken against. When Azikal was talking about alternative medicine for hemorrhoids, people were smiling, but now we're no longer there. It's dramatic what's happening. When we see the way that patients are stopping their chemotherapy because you have to eat raw materials, and that will save them. When we see men as Professor Joyeux, who is having the Parkinson patients stop their treatments paid to have these pseudo-molecules, well, and also the campaign against vaccination, which was terrible, which was almost like a complot, which were led by a certain number of persons. Well, we really will have the opportunity of talking about, I'm not going to talk about the GRU in Marseille, but this is really a real problem today. Now I have you, Hélène ROMDHANE. You are the head of the Interministerial Mission of Vigilance and Combat Against Sectarian Aberrations. What is the situation today? Where are we really? Before talking about the problem, I'm going to talk about define the notions that we're talking about, so we all are clear. Now, what are we talking about? We talk about sectarian aberrations. The definition is it's issues with you have the against public order and the fundamental rights of everyone, against safety and against the integrity of people. And the subject is really concerning physical integrity and fundamental rights when we talk about the right, but also the clients. When we talk about these aberrations, they are not essentially just the doctors that are practicing them. When we talk about these sectarian aberrations, and the second notion we need to define is what is a healthcare treatment which is non-conventional. This is a method of treatment which is not approved scientifically, which is not recognized by science, and is not within the professional program of the healthcare sector professionals. So we think these kinds of non-conventional treatment are really a danger. Why are they a danger in our society? Well, they become a danger either because they become a therapeutic or treatment aberration, either because they become really something which is related to the competence of the individual. They lose their freedom. What are we talking about when you talk about this treatment aberration? We're talking about this expression when the charlatan, the leader, charismatic leader, the guru, etc. These are allegorical. These are really delinquents and criminals. We should call them that. When they convince a person who needs to have a treatment to refuse their treatment, so they propose other things which are not just proposing an alternative, which is actually when you say you should refuse this treatment, and this is what I propose to you, and this treatment will actually increase the health issues, and it won't in any state really help him with the necessary treatment that he needs. These charlatans are proposing the consumption of hallucinogenic products because they open up their chakra and their relationship with the different positive energies, and we have no scientific report has shown that this is really something that's positive. So otherwise, they say it's not their competence. So all these different, not all these aberrations in the health sector are connected to sex. But now when we talk about sectarian aberrations in the health sector, in fact, you were talking about them in giving us some examples. This is that these practices are not really, you don't have a framework because they're not under the health ministry, and within these different with these practices without any framework. So what's going to happen is the patient, who in reality is a client, but he feels he's a patient, they will have this relationship of really a mental prison because of this manipulation. So this patient will be in a dependent relationship to this person, and they will be actually adhering to all the different dogma in an unconditional way from this charlatan. And this patient, this client, for him, will be listening and be applying categorically with their eyes closed everything that this healer, this prophet of health will be proposing to him. And this is where the danger is, legally speaking, because in fact we're talking about this error and malpractice. So legally speaking, this is really something going against health. You're giving us names. I cannot give you names, but obviously this is really hurting or damaging our society today. And the sectarian aberrations in the health sector, well, have been defined now. So I would like to know would like to hear from the representative of the families that are victims of these codes. Joséphine, is this a situation that is increasing? How do you see the subject today? Yes, clearly we have seen in the 5,000 different cases last year that half of them were in the area of health. These cases, we have families who are calling us. They want to be supported because they've lost their spouse, a child, who actually joined this systems or with non-conventional practices, and the damage is really tremendous because often, in fact, in medical terms, these persons are already vulnerable, and so they need help, they come for help. And this notion of beliefs is mixed with the health center. I'm suffering too much. I'm going to look for something else. I'm going to do some searching on the internet. We saw in the lockdown there was lots more of these kinds of cases and these people were not finding solutions. And so, the medical field, there's not a miraculous solution. You have to follow a treatment. And so you have this situation where these non-conventional practices really are hurting these families that are have individuals victims of cults. So, yes, I don't know if it's an agency or an association. Yes, it's an association, which we were talking about this subject, saying it really is an issue for public health. So there's alternative medicine and complementary medicine. So this is after the observation of this explosion of these kinds of sectarian aberrations. Well, there's two reasons why I'm really interested in this subject. Three reasons: because I'm a surgeon, and so I deal with people that have neuropathological pains and issues. And in our support program, at one point, we do have limits. And this is kind of like what we're talking about, these support treatments, like for cancer patients. So we have patients where they will have this neuropathological pains, and so either because the patients were talking to us about this, and this is what you need, or because there's, we would propose these kinds, some Scientology meditation or full consciousness, mindfulness. So I was become interested in geriatrics. We do have different activities in this complementary medical area. We could reduce medication by 2. What really, concerning the subject, was that basically this is a subject, an area that is really vast, and there's not regulation and not structure. And the ministry that's handling this, there's a little body, but it's not really a subject that's really given the right attention. And 70% of the French professionals in the health sector say, we, the complementary medicine, this is a real subject. We're interested. There are 40% that are actually practicing this alternative medicine regularly. And so we were proposing during COVID some activities, complementary activities for stress management for health professionals, and there was good feedback on this. And so they're really, at one point, we have to have a collective courage to say we have to really get involved. There is we have the real need for this. This does answer some key questions. There's the issues of training, also the different rules of the game. And I'm going to end with this. I'll come back later on this point, because we're questioning fundamental questions. Our way of practicing alternative health medicine is something that can be on the table. So this reflection we're going to be having concerning this natural medicine, alternative medicine, you know that we don't agree in the terminology of things. And personally, I cannot understand when we talk about alternative medicine and complementary, either we're in medicine or we're not. And we are used to talking about different health, non-conventional medical practice. What we've seen, and I don't know if you've been following this, the explosion concerning Dr. Liebe and all this. We have two websites that are referenced by doctors and the different therapists who have these therapies that are alternative ones. When you go to Dr. Liebe website, you do have these quick appointments. You have a system that can be very efficient. But when we started going into this deeper, we saw that there are doctors who are not at all doctors. We did see also that you had aberrations in the system that were really grotesque. And so it's the same. We're mixing everything. So if you go to this Médecine, in this website, you will see that you'll find a therapist who does psychogenealogy to heal, as he said, for post-traumatic stress. And the person doesn't really understand what this is all about. It's just something that is really terrible. We were talking about the person who was doing a lot of damage with clairvoyism. We have psychiatrists who will be laughing, but you're proposing to healing depression by suspending upside down so that you have the depression going downwards. This is part of these different proposals. So concerning this point in particular is the fact that there is a legal void. There is a complete absence of taking care of these issues within the Ministry of Health. There's this difficulty because we don't forget, we have the rule of law. We need to maintain this rule of law. That means that we have freedom because we are not a police of the thought. We're not here to say you can't go see a natural someone in the area of all these different alternative medicines. We want to ensure vigilance so each citizen, when they decide to address any professional, it could be a doctor, so it comes from conventional medicine, or with these kinds of therapists, so when they say they realize that their consent, their choice, it's like with the be giving one to the doctors. They need to be enlightened and informed in their decisions. We are not there to say, don't go see this different practitioner. It's not the practice is the problem. It's really the practitioner. We can be also natural alternative medicine experts, but there's maybe, if that was the case, only one of us that would be proposing a natural alternative medicine, which would be, and which is connected to all of this, the problems that we have with this explosion with this website, Dr. Liebe. We don't, it's the practitioner who is the problem, not the practices. We have to really go against the practitioners. I wanted to ask you, your title, which is MIVILUDES, is an interministerial mission, and so the Ministry of Health is not interested in that, if you say. So what do you do with the ministries that are interested? Well, you can talk about national education as well, the Ministry of National Education. The MIVILUDES is an interministerial mission. We work with all of the other ministries. The Ministry of Health, as you said, has not been addressing this subject in depth. There is a real difficulty, and so we have to go much further. The Ministry of Health, already for 2 or 3 years, everyone knows, is confronted with this enormous COVID problem. So when we talk to them about these kinds of issues today, these non-conventional healthcare systems, we don't have our answers today. Now, what is really pressing to do is to have a meeting with all of the missions like ours and the Ministry of Health concerning these different issues, but without, of course, going against the MCA, which is your agency. This is an issue which goes to the responsibility of the state. You see, it's the state, first of all, that has to really handle this because it's the interest of the patients. It's really something in the public interest. It's not a private interest. The association, they have their roles, and they are really important in the whole territory, but it's really the state that has to take its responsibility fully. What we want is say, how can we fight against this? We all agree, and Philippe, I'll give you the floor right away. We all agree, but we don't see much happening. What can be done at the level of associations that are concerning a complementary medicine? I don't want to call it alternative medicine because I think that could be a linguistic problem. What is the major problem today? Because if we wait for the state, we're not going to advance. And so in a few years, we'll still be at a standstill. There are people dying because of these aberrations. Now, there's just a somatic problem, which is international. When we talk about complementary alternative medicine, this is an international wording. Yes, I can understand, but I really agree with you. We can call this, there's different ways of calling this. This is part of the subjects that we really have to handle. What do we have to do? There's a real subject, because we do have a subject. Training is very important. So it's not normal that we don't have enough training, which is recognized by this gigantic mass of offers and therapists that are training. You could be in self-neurology, which could be something professional, or it could be something done in a weekend that's not professional. There is a problem, a major problem, to really have rules. A therapist, what is he committed to doing? We are saying we want to have a Hippocrates kind of sermon. What is the obligation? And this is really what we're saying. A therapist who says to the person, you are going to stop all relations with your GP, your family doctor. We don't integrate what you do in your healthcare pathways. At one point, we need these different rules of the game. We need to define a minimum of corpus that are concerning this non-conventional area. We need to define it very carefully. We, at the same time, at the level of professionals in the health sector, we need to talk about this subject, because this subject is really very important. How many in our daily practice we see someone who has a chronic pathology, or he has a cancer, and that is reoccurring. And so, what do you do? What do you do? Do we take time to say, how do you handle your pain, etc.? In fact, one of the persons from this agency said 1/3 of the patients who had breast cancer stopped. They refused their treatment, and they started complementary medicine. So, for professionals, the question is, what can we do? The difference between us is we listen, we take into consideration the person in all their different dimensions, and we do that much better. So it's fundamental that what I'm saying is that if we would take more time, if we had a more holistic vision of a person, the way we create this kind of a climate of a trust. Why would 1/3 of the people throw out their prescriptions when they come from the doctor's office? Well, it's these complementary medicine are also requesting our practice today. If we really want to have a real smooth healthcare pathway, we have to rethink things. I hear what you're saying. Well, the first criticism that has been addressed to the conventional medicine is its coldness. I am considered as an object and not as a subject. And so they have announced to me, we heard about this roundtable when they were talking about the announcement of the death or pathology, which is really serious. And it's announced to the patient in such as if it's no big deal. But when you say, on the other hand, when you talk about the non-conventional health, which I think is the right way to call it, when we talk about the non-conventional practices as a magistrate, we have to be clear. The term we use should not lead us to think that it means something else. These non-conventional practices, that means that it's non-conventional. It's not conventional medicine. The alternative and complementary medicine, we say, okay, why not? Why not? But when we say that this non-conventional medicine practices, this is what is sold. This is what is saying, yes, we listen more to them. We listen better to the patients. They are clients because you don't have a relationship with the doctor. So the client can be interested, and you have the economic issue as well. I can tell you that within our organization, MIVILUDES, and this since the crisis of the COVID, we've had the social crisis and all these explosion of these kinds of aberrations, and it's good for everyone. We really are still in a crisis. So those people that have lost their health and lost a family member, and they couldn't even bury them, and so they dropped actually the conventional medicine for the unconventional one. I'm listening to you, but don't forget that we, the practitioners, that we deal with, what their interest is, with what we're talking about, this is to really take advantage of these people that are vulnerable and manipulate them. So that's what's bad. So patients are not idiots. However, you said, often we believe that these are people that are vulnerable, that are weak, but everyone can be caught up in the system. They're not psychiatric cases. Now, what can we do? I confirm that the victims that we see, these are people like you and I, and there's no difference of intelligence or social category. We meet all different kinds of persons. That's sure, but you have to not necessarily be fragile or vulnerable to get involved. It's the penal code in the article that exists, which consecrates the state of weakness. It's noted in black and white that fragility is not pre-existent. It's not. It is born because the person is subject to another person, and that leads to fragility due to manipulation, etc. Yes, this is something when we heard the preceding roundtable, when we were talking about this patient and his level, we say, I do consider that all of us have the capacity of understanding and we're not idiots. Okay, the patient's not idiot, but he's looking for solutions. And it's this, if he meets a bad person, he can really get involved in these kinds of bad areas. In France, we don't have enough support against this. In some ministries, we have to work further with them and more in depth. But we're in a country where we're lucky to have the MIVILUDES. It doesn't exist in other countries. We have other associations that have been in existence for 40 years that are following these victims of cults, and then they give us information at MIVILUDES concerning serious cases so that MIVILUDES can actually really start up these legal proceedings with the prosecutors. So we do have a good network of experts competent in this area. What is missing is information that is clear, specific. What is it? It's for this reason that I do understand your approach is very positive, but alternative medicine in that area, we're still mixing vocabulary. And so in fact, personally, I rarely use this sectarian aberrations. We talk about really being grasped in the midst of these sects, caught up in the sects. But yes, okay, yes, it's a therapeutic aberration rather than a sectarian aberration. Everyone, in fact, we have an audience here that represents some million persons. That each one of us use a different vocabulary. Everyone's getting at loss. They're not all legal or healthcare professionals. It's really important while we're waiting that one day we will really take this up and have a common definition. If all of us, and I do feel this is in general interest, people have to agree so that the terms used are the same, and the one that has a diploma and the one who doesn't have one, when we talk about these non-conventional healthcare practices, they know what's behind it. So, and we have to be careful of the qualities we're using. The issue of vulnerability, it is fundamental. Everyone has to be aware of that. Vulnerability, we can all in this room one day really be caught up in a sectarian aberration, because we could have an event in our life. If you say your child has a serious illness and the conventional medicine says there's no solution, you can count on me. I'll be knocking on the door of all my different clients that I had at the MIVILUDES. Why? Because a parent cannot say, I renounce of all healthcare. If there's a serious illness that is announced to me, what we're talking about, so I give you this. When you see there's a decision from the National Council of the Order of Doctors with the suspension of the practitioner for 2 years. When you have a death, 2 years is nothing. The person had a breast cancer and started the chemotherapy, and at one point, you are right to renounce your treatment. I can do it if it's my own decision. This person renounced the treatment, said, I cannot manage this anymore. Stop. She stopped this treatment. However, she finishes by going to finding this miracle healer through Google. He's a doctor, and he proposed injections of this special product. And we know that you professionals, you know that this plant cannot save them from cancer. This woman, of course, she died. There were not any, we didn't have any, the National Order of the Doctors actually had to really handle this. And so there were 2 years of suspension, which is nothing against this, because it all comes back to she refused this she was using this mistletoe treatment instead of the real treatment. So, okay, when we talk about, we have a lot of work that's being done collectively, but we do have a real problem of evaluation criteria. There's a big research project in which we're participating in Montpellier to try and agree collectively on the way with which, so in other words, we can have the corpus, the criteria for evaluation of these different kinds of interventions. It's very important because we have more and more of these that are integrated in support health care treatments. In our legislation, in our country, we have a lot of possibilities to really make complaints, alert. We have a penal code which is very much furnished. We have legal issues, illicit things that can be taken up. Well, I think this is one of the problems. We do see a certain number of, under the pretext, because they have the title professors. So we do see things that are not going the way they should. Now, what I propose, you should get together so you can be a unit and you can come up with common definitions. So you work on this after this. So you are not the Minister of Health, but you are almost. So what do? You have 15 seconds against sectarian aberrations. I would have training, clear, precise, and the person that they realize this is manipulation, mental manipulation, sectarian aberrations that we're talking about. Well, I would really have an inventory. This non-conventional medicine. I would have forbid all training, like we have at the University of Strasbourg, anthropology as to be considered to be doctors. No, that's not right. And I would have special controls in all the establishments, education. If we, in all the different health care situations, you have all the different non-conventional practices that in these healthcare centers that are actually offered and not serious people. So, in fact, what I do believe that I would open up this file, this dossier. I would say, yes, we weren't handling this. At one point, we have to really put it on the table. Yes, we're going to put this subject on the table. Thank you very much, and see you soon.